ដើម្បីទទួលបានវីដេអូថ្មីៗលោកអ្នកគ្រាន់តែចុច Like Subscribe សញ្ញាកណ្ដឹងជាការស្រេច
10:28 am National News, Security and Society. 3. Banteay Meanchey Province. According to sources from the Provincial Health Department and Banteay Meanchey Provincial Court, an inspection report was issued. Submitted to Ministry of Health for technical decision and submitted to Deputy Prime Minister K. Kim Yan, National Team Leader. Help Banteay Meanchey to succeed. Decide whether or not these officials will be retained later. Controversy and heated criticism after medical officials and the director of the Department of Health clarified the case of women. And the baby died after being chased out of a state hospital for a lack of financing. 600,000 riel and no blood provided at Friendly Hospital. Cambodia, Japan, Mongkol Bori in this case involved officials, doctors, midwives, mother and baby deaths. December 2019. Then the doctors involved in this case came out to the public that the principal of the Friendship Hospital of Cambodia, Japan Mongkol Bori must provide services to all people in advance of payment or after payment. Following, if patients are unable to pay, there is a charity fund in favor of the hospital needs. Case of In Chan Mom, 26, of Ko K Village, Russi Ko Commune, Mongkol Bori District, Banteay Meanchey Province. The second preterm hospital, delivered by its first child, was admitted at 9:10 a.m. on the 1st of the month. In December 2019, due to a fluid leak prior to birth, the woman had severe back pain. Down and occasionally bloody mucus, women with abnormal preterm birth and this baby. There was a slight bleeding for 2 days at 7 months of pregnancy, and in the evening there was less bleeding and abdominal pain. Ultrasound found a cervical mucus after a doctor's examination and gave birth. It was advised to the patient and her mother that the woman had to have a cesarean delivery after listening to the doctor's explanation. The woman and her mother decided to have a thumbs up on the cesarean section, but then the woman changed her mind. Take birth at Kantha Bofa Hospital in Siem Reap. Concerned about the safety of the mother and baby as well as the woman's condition, doctors advised the ambulance to stay. At the hospital, the woman was taken to Kantha Bofa Hospital in Siem Reap, but she also chose to travel on her own. Then call the taxi and take it to the hospital. By the middle of the road, only half of the road had been killed by both the mother and her baby. The women's body has condemned the clarification and is intent on evading the responsibility of citizens' lives and medical ethics. And distort the truth, and worse by that. Not only did the victims feel sympathy for the victims, they created systematic blame for the victims. Poorer and more foolish. In his statement, Drive. Chan Vitavarav Youth, president of the Cambodia-Japan Friendship Hospital, said that he was out of the investigation and because of this, he was on a mission to Kampong Cham. However, he has expressed his condolences to the victims and their families. He is deeply saddened by this. It happened in a hospital that was trying to provide good health and well-being. The midwives, who were responsible for the birth of the woman, sought clarification, but they did not cooperate. Dr. Chow French, acting director of the hospital, could not be clarified, as was La Chan Sieve, deputy director of the Banteay Meanchey Provincial Health Department, who directs the health inspector down the case. Dr. Ko Safiktra, director of the Banteay Meanchey Provincial Health Department, told reporters that the mistake was the death of the woman and the baby. It is a professional error of doctors, midwives, and administrators in this section and level of the hospital. Really, everything is just like the mother of the victim. He said on social media that doctors ask for money before surgery, and doctors say they don't have blood if they have surgery. Yes, in this case, the victim and the victim's mother are at fault, but less than the doctor because the patient is emergency, and foolish and poor, and thus destiny. On the doctor, that is, unless the patient is discharged from the hospital in a dangerous situation and transported. Illegal taxis, even if the patient dies in a hospital for surgery, pay attention and look satisfied. Also,